The most effective way to make and maintain improvement of your hip mobility is to work on it at the capsular level using the hip CARs, or controlled articular rotations. And you can use this as a joint warm-up to remind the tissue the motion that does have available before any activities or in the morning. But you can also use it to create adaptation and new control over motion by increasing your level of irradiation or increasing the foundation of the rest of your body so that you can isolate the motion more at the deep hip structures so that you can really concentrate on moving slow and creating change. So let's work through it step by step. We'll review by using the wall to increase our irradiation or our foundation as maximally as possible without using any other tools. You're going to step away from the wall, keep your feet together, really make sure that spine is neutral. You got underneath that belly button drawn in. And then you're going to take a deep breath in. As you let that breath out, press your hand to the wall, press your other foot into the ground as you lift that knee up to in front of your hip. And then you're going to work on rotating the thigh in the hip joint, trying not to let that lower back arch back. Extending through the hip as much as you can, and then returning back to that start position. The greater the isometric contraction you can create through the rest of your body as a foundation so that you can isolate the motion in the hip joint is going to allow you to make greater amounts of change in your motion and your control over that motion. So really work on that in a concentrated way if you are doing this higher level. If you're just going to be doing a warm-up, then you can do it standing or just place your hand on something for a little balance and do just like a 20 or 30% irradiation, just a light irradiation, just trying to warm that joint up, so not as much intensity. Let's move through this together. So you're going to face the wall, put your feet together, draw in your lower abdomen, pinch your shoulder blades lightly back and down to the brow line so you have a nice neutral spine. Translate that chin back. You want your ears over your shoulders, over your hips. Now put your hands against the wall, like palms against the wall, just a little bit lower than your shoulder joint, and press those palms into the wall. Now you can step your feet back slightly if you need to help you balance a little bit. Find a good position so that you can make sure that you have good deep core engagement to support that neutral spine. The further you move your feet away from the wall, the more difficult you will make the task. Let's work through the right hip together. Take a nice deep breath in, and as you let your breath out, engage that deep core. So draw in below your belly button towards your spine. Keep the spine neutral. Shoulder blades to the brow line, chin back. Press the hands to the wall, left foot into the ground. Now you're going to raise the right knee up as high as you can. Now open the knee out to the side, and you're going to rotate the thigh in the hip joint forward and down, bringing that ankle up towards the ceiling. And you're going to work on trying to pull the thigh back in the hip joint without creating an increased arch in your lower back. Circle your motion around the back as best you can and bring your knees together. Now you're going to reverse the motion by kicking back, pressing the knee out to the side as you rotate the thigh up and back, bringing that ankle under the knee and you rotating it back around the front. And let's repeat it. Bring that knee up in front of the hip, open your knee out to the side and rotate that thigh forward and down, bringing that ankle up towards the ceiling, and work on extending the thigh, pulling the thigh back in the hip joint as you circle it around the back to bring the knees together. Now reverse the motions. You're going to kick back, lift the thigh out to the side as you start to rotate the thigh up and back, bringing the ankle under the knee and rotating back around the front and bring the knees back together. Great job. Now perform it on the other side.